Welcome to my channel. This is Dr. Lilian Andrade, and today we are going to be talking about the difference between Medicare and Medicaid. So let's get started. Medicare and Medicaid both provide healthcare coverage for older adults, but they're not the same. Knowing the difference can help you guide your patients to the best care options. So let's break it down. Let's start with who qualifies. Medicare is a federal program for adults 65 plus who are U.S. citizens or permanent residents who has lived in the United States for at least 5 continuous years. Eligible if you or your spouse paid Medicare taxes for at least 10 years, 40 quarters. If not enough work credits, you can purchase Part A by paying a premium, and Part B is optional but requires a monthly premium. If you're under 65 and disabled, you can be eligible if you have been receiving Social Security disability insurance for at least 24 months. No waiting period if you have ALS, and you are automatically enrolled in the Part A and Part B. Patients diagnosed with end-stage renal disease requiring dialysis or kidney transplant must apply for Medicare coverage, and that begins the first day of the 4th month of dialysis treatment. For initial enrollment period, there is a 7-month window, 3 months before turning 65, the month of your birthday, and 3 months after. General enrollment period starts on January the 1st to March 31st each year, and coverage starts on July the 1st. Special enrollment period is available if you delay Part B because employer coverage or other qualifying events. Medicaid is state and federally funded and based on income and assets. Eligibility varies by state but generally covers low-income individuals, including older adults. In Texas, by 2025, for an older adult, the income limit is approximately $2,742 a month. Patients can be dual eligible, meaning that they have both Medicare and Medicaid. And then, in this case, Medicaid will cover for costs like Medicare premiums and co-pays. Medicaid covers for long-term care like nursing home and assisted living in some states. In-home care services is medically necessary, Medicare premiums, deductibles, and co-payments for dual-eligible individuals. Durable medical equipment, the DME, with no or low cost, transportation to medical appointments, and additional service like dental and vision and hearing aids, which varies by state. Now, let's break down Medicare parts and what they cover. Part A covers inpatient hospital care, short-term skilled nursing facilities (SNF), hospice care, and limited home health care. Cost for Part A depends. Most people don't pay any premium if they or their spouse worked and paid Medicare taxes for at least 10 years. Deductibles and co-insurance apply for hospital stay and skilled nursing facility care. Part B covers for outpatient care like doctor's visit and preventive services, mental health services, ambulance services, physicians or nurse practitioner visits at home, durable medical equipment like wheelchair, walkers, oxygen equipment, hospital beds, etc. For Part B, there's a monthly premium and varies by income, annual deductible, and 20% co-insurance for most services. Medicare Part D is prescription drug coverage offered by private insurance companies. It helps pay for medications that are not covered under original Medicare. Starting this year, 2025, the Inflation Reduction Act introduced significant changes to Medicare Part D, effectively closing the donut hole. Here's how it works. Now you pay a monthly premium and co-payments or co-insurance for prescriptions. Once you reach $2,000 in out-of-pocket costs, your spending stops for the rest of the year. After that, you pay nothing for covered medications. These are good news, no more donut hole or catastrophic coverage costs. Medicare Advantage, Part C, is an alternative to original Medicare offered by private companies. It bundles Parts A and B, and sometimes Part D, and often includes additional benefits like dental, vision, hearing, and wellness program. Pros include extra benefits like dental, vision, and hearing aids, and out-of-pocket maximum unlike original Medicare. Cons include network restriction, HMOs and PPOs, and co-payments and co-insurance may be different from original Medicare. What about home health care? Here's how Medicare and Medicaid compare. Medicare Part A or B cover for short-term skilled care at home, like nursing, PT, OT, speech therapy, if the patient is homebound and has a physician's order. No custodial care like help with bathing, dressing, or cooking. However, Medicaid covers for long-term personal care like bathing, dressing, cooking, if the patient meets state income and medical criteria. Some waiver programs allow care at home instead of a facility. Now, let's break down how patients qualify for different types of care. For a skilled nursing facility, SNF, Medicare Part A must have a 3-day inpatient hospital stay, and the patient must require daily skilled care like physical therapy, IV meds, or wound care. Medicare covers from day 1 to 20 with a fully coverage. From days 21 to 100, patient pays a daily copay of $200 a day in 2025. After day 100, there's no coverage, so Medicaid or private pays kicks in. For inpatient rehab, Medicare Part A requires intensive therapy at least 3 hours a day and must be medically necessary. For long-term care nursing home, Medicare does not cover long-term custodial care. Medicaid covers it if the patient has limited income and assets. Patient must meet state-specific functional and financial criteria. Assisted living is not covered under Medicare nor Medicaid. However, some Medicaid waiver programs help in certain states, but most patients paid out of pocket or use long-term insurance. For independent living facilities, neither Medicare nor Medicaid covers for it. Patients paid out of pocket or use VA benefits, retirement funds, or long-term care insurance. Hospice Care is covered under Medicare Part A and Medicaid. In order to get it, is required a doctor certification stating that the patient has a terminal illness with a life expectancy less than 6 months. Patient must agree to comfort care instead of curative treatment. What's covered under hospice care? Pain and symptoms management, medical and nursing services, counseling and social services for patient and family, hospice care, which is short-term inpatient care to provide relief to caregivers, medical equipment and supplies related to the terminal illness, spiritual support and grief counseling for the patient and family, and short-term inpatient care for pain control and acute symptom management. What's not covered is curative treatment for the terminal illness, room if receiving care at a nursing home, or services not related to the terminal illness. What is the cost? It's $0 for most hospice care. However, there is a small copayment up to $5 for outpatient prescription drugs for symptom control and 5% coinsurance for inpatient hospice care. Durable medical equipment, DME, is covered under Medicare Part B and Medicaid. These are medically necessary equipment prescribed by a physician for use at home, including wheelchair and walkers, hospital beds, oxygen equipment and supplies, glucose monitors and test strips, nebulizers and medications related to the nebulizer machine, CPAP devices for sleep apnea, prosthetics and orthotics, commode chairs, and patient lift. These must last more than 3 years in order to receive new equipment. Patients pay 20% coinsurance of the Medicare-approved amount after meeting the Part B deductible. Some items are rented like the hospital beds while others are purchased. Now you're ready to tackle Medicare and Medicaid like a pro. Don't forget to subscribe for more tips and drop your questions in the comments. Let's keep learning together.